Hello, my name is Hunter Breckenridge, and I am a second-year professional athletic training student at the University of South Carolina. And today I'm going to be talking to you about acute hand and wrist injuries in experienced rock climbers. There we go. So the methods. They had a questionnaire sent out to 1,100 members of the Climbers Club in Great Britain. And from there, they had them list out the injuries they've received while rock climbing, and they had to be while rock climbing. They couldn't be other injuries that were just exacerbated by the rock climbing. And they had different categories, including fractures, dislocations, crash injuries, burns, cuts, abrasions, and tendon damage. After they got that, they also were asked about their frequency of climbing and the intensity grade of their climb. So were they going up small little hills? Were they going up mountains? Were they going up sheer rock faces? Stuff like that. And then they were graded based on that information from 3 to 19. And then they multiplied that number by the average number of days a year they climbed to kind of get like an intensity score. And then they added those together to give each climber the intensity score. From that intensity score, they were able to kind of see a pattern emerge versus intensity of the climber and then the number of injuries and then the type of injuries. And a normative p-value was established at p is less than 0.05. And that was used to establish significance in this research. So the results. So 545 questionnaires were completed and used for the study, and then 496 of those were male and 49 were female. The mean age was 50 years old, the mean time of injury was 33, and the mean age between time of injury and the survey was 19 years. So that just kind of shows that some of these people have been walking around with these injuries for quite some time. There were 155 climbers with injuries, and out of those 155 climbers, there was 235 wrist and hand injuries, which means that some climbers might have had both hands and wrists hurt or hurt themselves multiple times. The mean climbing intensity score was 3,281 of the injured group, while the uninjured group was 1,877. So that definitely goes to show that there is some correlation between intensity of the climber and injuries. And it was statistically significant, because P equaled 0.01. So we're going to break those injuries down, or those results down a little bit more. So the most common were finger tendon injuries at 33%. It also included non-specific finger tendon injuries at 25% and those with A2 pulley injury ruptures at 8%. Lacerations to the wrist, hand, and fingers occurred from contact with the rock during climbing falls or rock falls were 15%. Fractures were common, 12% were in the wrist, while the phalangeal metacarpal bone fractures were only 7% of the time. Phalangeal and thumb dislocations were at 13%. Rope burn from falling or from saving somebody else was 9%. And less common issues include soft tissue, wrist sprains, crash injuries to the hand, frostbite, and finger amputation. So discussion. So 83 to 89% of rock climbers have repeated acute injury symptomatics for at least 10 days. That's at least. So it means that whatever acute injury they suffer, they are having symptoms for at least 10 days following the injury. Acute injuries mainly occurred from sudden tendon, ligament, fall, or strain. So they weren't just overuse injuries for the most part. They were mostly an acute type of injury, and half occurred during training, and then 2/3 occurred during the ascent. So that shows that training and actually rock climbing is equally as dangerous, and ascending is more dangerous than descending in terms of injuries. And then 40% of 40+% of indoor rock climbers suffer from overuse injuries, which is a little different than outdoor rock climbers. About half of acute climbing injuries are in the wrist and hand. Compared to other populations that they looked at, they found that the Climbers Club of Great Britain may have 14 times more than the normal number of hand injuries for the general population. However, it could just be maybe that what the rocks were or the climbs are more intense here. More research would need to be done into that to kind of further understand why that number is much greater than the other rock climbing organizations. And there is a significant increase in injury when intensity scores are higher. So more discussion. So the tendon injuries of the fingers were the most common, and this was expected due to the repetitive high torque movements of the fingers and the hands to ascend a rock face. What was interesting is that the standard handholds used can result in acute rupture or acute episodes of tendinitis. So the rock holds they use to get a good grip on the wall, the type they use can predispose you for certain types of injuries, which was pretty interesting. So Wrist sprains were 5% of injuries and came from using repetitive undercling rock holds, while A2 pulley injuries were most common when crimp cling grip was used along with a foothold slip. It's recommended that fingers are taped between the joints to reinforce strength when rock climbing, and they also found that more experience leads to greater chance of injury, which I think thinking kind of in the general population is kind of the opposite. We think that the younger and more unexperienced they are, the more predisposed to injury they are because they don't know how to play the sport or move their body, but that is opposite for this population. So take home messages. So the higher intensity number a climber has, there's a greater chance of exposure to injury. Due to more time on the course, harder courses, and more often severe as a lead climber. Equipment use can predispose climbers to specific types of hand and wrist injuries. Important to know your athlete's level and preferred equipment to have a good idea about what they're exposed to. If they use the underhand clings, you might expect different injuries than the standard clings, and knowing that would help you prepare and maybe do some prevention work with them. Some injuries go undiagnosed and therefore are not properly treated, so patient education is important. If you don't catch a muscle strain, you keep climbing on it, it can lead to worse problems later on down the road. And you cannot change the sport or the equipment, but you can better prepare the athletes of the competition with proper prevention protocols. Rock climbing is rock climbing. You can't really change the mountain or the course or the equipment used because a lot of it is for safety. But just what this study really looked at and really kind of showed was knowing your athlete's risk of injury and knowing what type of injuries they are at risk for, and finding prevention protocols or strategies to help work with them to help make sure that they are safer while climbing. This is the article that we looked at, and I just wanted to leave you all with this quote. And if what you are is strange doesn't mean you should change you, it only means you should change your point of view. Barbie, I think that is pretty inspirational and just kind of helps kind of put yourself in better perspective. Yeah, so thank you so much. And I hope you all have a great evening.